All right. Good evening. Thank you for everyone who has joined us and those who are watching this from home. We are glad to have reinstated our community teleconference calls. And so we hope to continue doing so to provide updates regarding COVID-19 and what the city is doing about it. Just so you know, my name is Marsha Noel, assistant to the city manager, and it's my pleasure to facilitate this evening's call where you'll be provided updates from our fire chief and also our city manager, Jonathan Evans, both who operate within our emergency operations center, especially as it deals with COVID-19. Later, you will also be receiving an update from me as it relates to communications. And then if anyone has any questions, if you're on this call, please feel free to ask a question. And then anyone who's listening to this call at a later time, you can ask a question as this will be posted on our social media accounts, and we'll do our very best to respond to you. Otherwise, you can also send us an email at citymanagersoffice@rivierabeach.org. With that being said, I do want to let anyone who is listening to this call know that you can join our teleconferences through the phone number that was provided in the advertisement, which is 1-646-176-9923. And the meeting ID number is 896-779-75888. And we'll continue using these same numbers for subsequent teleconferences, so you can keep that saved. With that being said, without further ado, I'll go ahead and hand it over to our city manager for his introduction.
Good evening, and thank you everyone for joining the call. And I too am certainly appreciative of us starting these calls back. I think there's a lot of substantive information related to COVID-19 that has to be shared with the community, and more importantly, how we continue to make persons safe as we respond and provide services to our community here as a result of COVID-19 and what we're seeing. So I'm going to turn the presentation over to Fire Chief John Kurd. That's going to provide you a lot of substantive information concerning COVID-19, and then I will circle back and share some remarks before Ms. Noel closes us out on the communications piece. So without further ado, Fire Chief John Kurd.
Thank you, Mr. Evans, and good evening, everyone. I've been working very hard over just the last hour trying to get some new information as it's been coming out from the CDC. So pardon me as I shuffle through some of these papers. And if you are listening, you may want to go ahead and get a piece of paper and a pen or pencil, because I will be sharing some information, some websites, and some phone numbers that you all may want to utilize in the need for different types of correspondence with the government as it relates to vaccination cards, and the like. So earlier this week, or towards the latter part of last week into early this week, the FDA had submitted a request for emergency use authorization for booster shots for individuals that have previously been vaccinated. That was approved by the FDA, or excuse me, Pfizer submitted it to the FDA. The FDA subsequently approved that. Then it went to the CDC for approval. There's two sanctioning bodies, the FDA and the CDC. And just today at 5 o'clock, it was announced that the CDC has granted Pfizer the emergency use authorization for a booster shot. So the first thing I want to do is I want to go ahead and address the elephant in the room, so to speak, is what everybody's talking about is booster shots, third shots. I want to provide a little bit of context and clarification before I go any further. So there are two different types of shots that are available for COVID-19, or three, I should say. You have your general vaccination. If you've taken Pfizer or Moderna, that is a 2-shot regimen. If you take the Johnson & Johnson, that is a single-shot vaccine. What was realized after some trials and some data and some statistics were compiled is that individuals with compromised immune systems were not developing the level of protection that was deemed adequate, that the normal population was developing. They talked about this term efficacy, how effective the vaccine is. And the general population were reaching efficacy levels or effectiveness levels in the 90 percentile, 93%, 95%. But individuals who were immunocompromised were only getting into that 60, 65% efficacy. Based on that information, the federal government started looking at what a third shot would be. Don't confuse the two. The media does it all of the time, and it's frustrating to me because to me it's misinformation. There is a difference between a third shot and a booster shot. The third shot was approved for individuals who were immunocompromised. Who are those individuals? These are people that are receiving cancer treatment, people that have recently had an organ transplant, people that have received a stem cell transplant, people with a primary immunodeficiency syndrome, such as DeGeorge syndrome or Wiskott-Aldrich syndrome. Also individuals who have advanced or untreated HIV infection, and people who may be taking medication to suppress their immune system. So if you fit into that category, the federal government, CDC, and FDA were allowing for you to get a third shot so that your immunity would be comparable to the general population. Now, booster shots. Booster shots have been just recently, here within the last hour, approved for Pfizer and Pfizer only. It is approved for individuals over the age of 65 and also individuals 18 to 65 who are considered high risk. And when we talk about high risk, we talk about individuals who are hypertensive, high blood pressure, diabetic, suffer from diabetes, have cardiac issues or illness, COPD, CHF, asthma, severe asthma. These are individuals that are deemed high risk, severe obesity. There's quite a list of categories. And if you remember back when the vaccine was originally being rolled out, this is that same list. They didn't address individuals under the age of 18, even though we know Pfizer is eligible for people 16 and up. The emergency use authorization for a booster shot are individuals 18 to 65 that are at high risk. And they also included physicians. They also included first responders, nursing home workers, people that are at high risk for exposure to COVID-19 from the ages of 18 to 65. Anybody over the age of 65 will be eligible for a booster. Now, the federal government has not yet rolled out on when and how the booster shots will be delivered. It is my anticipation that we will hear some news tomorrow on what that plan looks like. And I would think by Monday, those individuals that qualify for the Pfizer booster will be able to get that Pfizer booster. We anticipate Moderna will be shortly behind, and then Johnson & Johnson will follow after Moderna, the order in which those different vaccines were approved. So just as a little bit of a recap, there is a difference between a third shot for immunocompromised individuals and booster shots. Anybody can get a third shot of any of the vaccines of the Moderna and the Pfizer. However, they must be immunocompromised. Booster shots have only been approved for Pfizer, and we are waiting for the government's plan on how they're going to roll that out. Talking about vaccines and where can we get vaccinated, and when the booster shot for Pfizer does become available, where is that going to look? What's that going to look like for us in Riviera Beach? Well, one, we have the Walgreens on Broadway and Blue Heron Boulevard that has openings available. We also have the Walmart on Silver Beach and Congress. Now, we do anticipate once the government gives the okay and a start date of the booster shots, a bit of a surge of individuals looking to get that booster shot. And one thing to remember is in order to qualify for the booster shot, it has to have been 6 months since your last shot. So if you were just vaccinated 3 months ago, you will not be eligible for the booster. You would have had to receive the booster or the initial vaccination 6 months ago or more. So those are some of the things to keep in mind. Those are some of the locations. We are going to monitor what the influx is on individuals looking to get vaccinated. What is our community's ability to provide that vaccination? And we're going to then determine whether or not the city will be offering vaccinations. But at this time, we don't anticipate the need for having to reopen our point of distribution site. But that is something we're going to keep a very, very, very close eye on. And if the need does arise, we will be ready, willing, and able, as long as the vaccine is available to us, to reopen that site. Some of the other things that have been coming across the desk here over the last couple of weeks are how do individuals get replacement vaccination cards due to them either being lost or damaged. The only way you're going to be able to replace a lost or damaged vaccination card, and there's a couple of ways here. You can contact the immunization section of the Florida Department of Health at 1-877-888-7468, or you can email them at immunization@flhealth.gov. If you received your vaccination in Palm Beach County through the Palm Beach County Health Department, you can email chd50 contact us at flhealth.gov. And this information was put out by Ms. Noel on many of our social media platforms, and we will continue to make this information available to you all in subsequent meetings. And if you need to reach out to any one of us here at the city, or if you need to reach out to my office, please feel free to do so. And my office number is 561-845-4104. And one of the individuals at Fire Rescue will be able to get you the information you need to replace a lost or damaged vaccination card. Some other important information: if you are going to be traveling outside of the United States, I would encourage you to check with your local airline in regards to where your destination is, because other countries are requiring vaccination cards or vaccination passports. And each country is doing it a little bit different. Some are using an app with a QR code. Some are requiring a hard copy. So please, if you are traveling, I don't want to see you get stuck at your destination in quarantine and or an inability to get back home. Check with your local airline on where you're going and what the requirements are, and then what the requirements are going to be for you to re-enter the US. And President Biden is getting ready to release some information on that here over the next couple of weeks. And as soon as he does, I will share that with you. We are still seeing a surge in the numbers. While I don't address numbers across the United States or for the state of Florida, I'm trying to stay focused in Palm Beach County because we're dealing with a situation now where each state is kind of doing their own thing outside of the federal government's requirements or mandates. And then each county within each state is also doing their own thing. So in Palm Beach County, over the last 7 days, we've averaged 1,000 new cases per day over the last 7 days. And we've averaged 100 deaths a day over the last 7 days. So the Delta variant is still out there. We have seen a downward trend in the number of cases and the number of deaths over the last couple of days. But please don't be mistaken. Even though we're seeing a downward trend, our numbers are still way above what we saw at this point last year. Some of the things that the city of Riviera Beach is doing is to continuously provide for our community and ensure their health, welfare, and safety is we are providing Regeneron treatment. Riviera Beach Fire Rescue has been able to obtain the monoclonal antibody treatment Regeneron. We have staff through Mr. Evans and his authorities allowed us to staff a vehicle that does in-home treatments for individuals who qualify for Regeneron treatment. And in order to qualify for a Regeneron treatment, you will have to have tested positive for COVID-19 and be experiencing symptoms, or you have been exposed to someone who has tested positive and you are experiencing symptoms. There are some other requirements. That's why we have a specialized unit. They come out, they do a medical evaluation, and if you meet the criteria, and if you so choose, we can provide this antibody treatment for you at home. I don't know how much longer this will last as they are starting to restrict Regeneron and moving it and reallocating it to certain parts of the country. And we are hearing now that they're actually starting to look at restrictions on who receives Regeneron therapy. But as of right now, your city, your fire department is able to do that treatment for you in home. And last, but certainly not least, as it relates to testing, there is still a demand for testing. And there are 2 testing locations in Riviera Beach on 2 different days. You have United Laboratories, who's out at Jay's Ministries at 2831 Avenue S every Tuesday from 10 a.m. to 4 p.m. And on Thursdays from 10 a.m. to 4 p.m., United Laboratories is at Wells Recreation Center at 2409 Avenue H West. So if you are looking for testing, both of those sites are available to you. Drive up, very convenient. If you are looking for vaccinations, you have Walgreens on Broadway and Blue, Walmart on Silver Beach and Congress. And that is the latest development. And sorry for being long-winded, but it's been a while since we've had this community update. And I wanted to make sure that our community was up to date on the latest and greatest. And with that, I turn it back over to you, Mr. Evans.
Thank you, Chief. And obviously, there's a lot of information that was shared in Chief Kurt's presentation, but certainly we want to make sure the community knows that we're doing everything in our power to provide every opportunity for persons to get tested where they can get tested in their community, as well as continue to encourage persons to get vaccinated. We're seeing the numbers continue to increase, and we can anticipate the numbers to increase as our winter residents return back to our community. So please be aware of that. Let's not become complacent or complicit with respect to our position as individuals. The Delta variant is still very contagious, far more contagious than the first iteration of COVID that we experienced on the onset of the pandemic. And so we are making sure that we continue to champion the cause as it relates to persons getting vaccinated. And if you have any questions, comments, or concerns with respect to that, please let us know and we'll provide you the information. And we'll also make sure that that information is enumerated in the actual post after this video is complete. So where you can get tested, as well as areas that are still providing for the vaccine. You are seeing that there is discussions about the possibility of the Pfizer vaccine making it through subsequent phases to allow persons that are between the ages of 5 and 11 to receive the vaccine. So once that information is readily available to us, we will certainly share that with the community. And as Moderna makes its way through getting full FDA authorization, we'll be able to let you know in regards to that. So there's multitude of opportunities out there to get vaccinated, and we cannot emphasize enough the importance of persons going out and getting vaccinated. Still continue to wear your mask, still continue to wash your hands. We are asking persons that come to visit us at any municipal facility to please submit to a temperature screening, as well as wearing the appropriate facial coverings. Staff is working on site, and we do have situations whereby persons are working remote. And so we are still providing the full gamut of service, but we are being conscientious of opportunities to minimize the impact to our workforce as a result of interactions with the public in a physical sense. But nonetheless, we're trying to do everything in our power to keep the workforce and the community safe. We do have some communication tools that are available to you. We have encouraged folks to sign up for our newsletter, as well as our Code Red notification system, and Ms. Noel will get into that in greater specificity. But please understand that it's still here. There's still other variants that are present in South America and other areas of the country, or other areas of the world, and we can anticipate being impacted, as this is going to be the way of life for a significant amount of time. We're continuing to watch what's happening both on the federal level and on the state level concerning COVID and COVID protocols and procedures. But nonetheless, we will be making sure that we provide the community the most up-to-date information that we have related to COVID. So with that being said, I'm going to turn the remaining part of the presentation over to Ms. Marcia Noel, who's handling the communication function for us here related to COVID, and she will close out the call.
All right, thank you, Mr. Evans. So just as Mr. Evans touched on a little earlier, he spoke about Code Red. So Code Red is the city's emergency alert notification system. So in the event of a critical incident, the city will be utilizing this system to push out emergency information to you, whether that is a catastrophic event, such as a severe weather, whether it's a public safety related matter, even with regards to COVID-19, where we've had to push out information during the early rollout of vaccinations. This system has been crucial in our ability to communicate with the community effectively and efficiently. We can send out thousands of messages through texts, emails, and phone calls so that you are up to speed, up to date, and informed on what's going on when it matters. So I'm going to go ahead and provide you with the 3 ways in which you can sign up for Code Red. I'm going to do my best to pace myself so I don't speak too quickly, as you may be trying to write this down. So the first way you can enroll is through texting. You can text to enroll. Just text the word RB Alerts, all in one word, RB Alerts, to 99411. Again, it's RB Alerts to 99411, and you can register by phone. The next option is to register online. Simply go to our website, rivierabeach.org/Code Red. And then lastly, you can register through phone call. You can call 866-939-0911. Again, it's 866-939-0911. You can select option 2, and someone will be there to assist you with registering online. You can call from Monday through Friday from 8 a.m. to 6 p.m. Next, I would like to let you know about how you can join our Blue Heron newsletter. It's an electronic newsletter that goes out bi-weekly. We provide updates regarding community events, various types of projects and things that the city is taking on, activities that are going to be of interest to you, to really show and demonstrate all that the city is doing to essentially move forward on various different projects and what we're doing in reaching our goals. So if you can, please take this moment to sign up for the newsletter. You can simply text to enroll. So you can text the word, the Blue Heron, again, all in one word, the Blue Heron, text it to 42828. Again, it's the Blue Heron to 42828. That way you can expect to receive emails on all the things that are going on, and share with your neighbors, share with your family members, let others know how they too can join our mailing list, because we are always thrilled and excited to share the information that's going on here in the city. With that being said, at this point in time, we are about to close out the call, but before we do so, if you've joined by phone and you have a question for anything that was shared today, feel free to unmute your line and share your question, and we'll do our best to answer. And I'll just give it a moment. All right, and so since we don't have any questions at this moment, we're going to go ahead and close out the call again. Thank you everyone for listening in on our community teleconference. Please remember again, these calls will be taking place weekly on Thursdays at 6 p.m. Same call-in information. We'll see you soon and have a good night.